Talking health now. September is the Childhood Cancer Awareness Month worldwide, serving as a reminder of the devastating impact of cancer on children and their families. Now, childhood cancer or pediatric cancer encompasses various types of cancer affecting children and adolescents under 19. But early detection can reduce fatalities and help with management, as symptoms often mimic those of more common illnesses or injuries. Common forms of childhood cancer include leukemia, brain and spinal cord tumors, nerve tissue cancer, and kidney cancer, among others. And as the nation, it is our collective responsibility to prioritize and support for our children bravely battling cancer at the moment. Now, joining us in the studio for this conversation is the Senior Registrar Pediatric Department at Lagos University Teaching Hospital, Dr. Oladunni Okoduga. We also have here with us the Chief Operating Officer, Dorcas Cancer Foundation, Dr. Korede Akindele. Good morning, gentlemen. Thanks so much for joining us on the program.
Good morning. Great to be here.
This morning.
Thank you so much for having us.
Looking at the statistics of childhood cancer, it's alarming by the day. So let me start with Dr. Korede. What do you make of this? It's a scourge ravaging the lives of our children.
Okay, thank you so much for having us. Like you said, yes, the prevalence of childhood cancer is increasing, and it has been the fourth cause of disease within children that kill children under the age of 5. But the good thing about it in this country, I don't want to use the word scourge. I want to, because there is a progression in what we are seeing right now. Yes, it's alarming. Yes, it's been seen in our hospitals, in our teaching hospitals every day. Cases are being presented. Yes, but these cases are still coming late as a reason of different reasons based on our environment here in the country. But I would say that childhood cancer outcomes in Nigeria is progressing. What we used to see 10, 15 years ago, which breaks our hearts, are changing gradually because of advanced knowledge and because of advanced partnership, advanced awareness. For example, an opportunity like this is making people to be aware that children do have cancers, and every child illness is not just the common illness that we all see. Because when you take a child to the hospital now, you know what everybody talks about. If you say, oh, I'm sick, somebody wants to ask you, maybe you have malaria, maybe you have typhoid, maybe you have infections. But healthcare workers, people are beginning to have an understanding that not all illness are malaria. Yes, it might present it like this. So it's giving us an edge to our work and begin to say, okay, child do have cancer, but early presentations and appropriate treatment is what brings survivorship.
Okay, let's look at the figures here. I'll come to Dr. Okoduga. Approximately 400,000 children are down with cancer globally. The figures, it's increasing. So that was why I used the word scourge earlier. What do you make of this?
So in Nigeria, it has been estimated that about 30,000 children would come down with cancers in a year. So this is an estimate because there's usually underreporting in Nigeria. We don't have enough cancer registers to know that, okay, this is the exact amount of children. Like in Louth, we see about 6 to 10 new cancer cases every month. So it's not like it's increasing, it's just that people are more aware, as he said, that there's something called cancer. Because before, people would just be sick at home and then the children die at home without a diagnosis. So it's because people are becoming more aware about it. I think that's the reason why it seems like we're having more cases of cancer.
But what is the reason for the high number in the first instance?
So children that have cancer, we really don't know exactly what causes cancer. Most cancers, or some cancers are caused by genetic problems. Some cancers, we say radiation, exposure to radiation, but most of the time, we don't know a cause. You know, because some parents are worried like, oh my God, how did my child get cancer? They start blaming themselves. Oh, we don't have cancer in my family. In my mother's line, there's no cancer. In my father's line, but you know, they start blaming each other. Maybe it's from the father's side. So most of the time, we really don't know what causes the cancers.
But what are some early warning signs? What are some, okay, this child looks like he might have cancer, or these symptoms are presenting like an early cancer detection?
Yes. So depending on the type of cancer. So for example, the most common cancers we see in Louth are leukemia. So you see a child who is always sick having fever, recurrent fever, always having blood transfusions. You have some spots on the skin. The tummy is getting bigger because the liver and spleen are enlarging. So those are telltale signs of leukemia. If it's retinoblastoma, for instance, that's cancer of the eye. When the baby is born, you see like a white reflex in the eye. The eye starts getting swollen. If it's a leg cancer, for instance, there's swelling of the leg. So it depends on the type of cancer. So that's how we know the symptoms and signs. Yeah.
Mr. Korede, how close are we to a cancer cure?
How close are we to
globally?
Globally, yes, there's advance in medicine globally, and then if you look at it, I mean, survival in the developed world is 80%. Yeah. Even in developed world, they don't discuss, I mean, survivor, they discuss the future of the child. For example, she mentioned retinoblastoma, that's the cancer of the eye. I mean, when they were discussing in the multidisciplinary discussion, they discussed the future of the child. They discuss how to preserve vision, that's what they discuss. So in the developed world, survival rate is 80–90%. But here we are dangling with 30–40% because of different reasons. So how close are we to cure? I would say it's a journey that here in this country, in Nigeria, we are moving gradually. We are not moving as fast as we should, but at least every steps we are taking now, it's improving. So that's why it's so important about early detection. Early detection is the key to survivors. Picking the signs early, like she said, I'm not generalizing every illness as this is it. And so that's why when children go into the hospital, we try as much as possible and say, okay, after you've done this, and you are not getting the results that you want, why don't you try this and let's know. So that is what gets us close to survival. And we are advancing in our care here in the country that is moving us closer to it. So,
and that's why you guys are here. September is the month generally known for the Childhood Cancer Awareness Month. For me, the right test to do, because a lot of people have been wrongly diagnosed in this country, and it's causing a lot of challenges, trauma for families. So how do you get the right test? Because sometimes you may say you're having malaria and they're telling you it's cancer.
Can I say this here?
Okay.
I think seeing the right healthcare professional is very important in Nigeria. So Nigerians don't understand that there are different types of doctors, for instance. You just say, oh, I saw a doctor.
Okay, you need to educate Nigerians this morning. So
yeah.
Tell us.
Yeah, so what is the specialty of this doctor you're seeing? So if I have a child that is ill and keeps getting ill, I'm taking the child to the hospital, why don't I see a pediatrician? A pediatrician is trained to pick signs of cancers, for instance. There are different specialties under pediatrics. There's a pediatric oncologist, the pediatric hematologist. If a pediatrician sees, oh, you need an oncology review, we send you to an oncologist. So Nigerians have to understand that what kind of healthcare professional are you seeing? And the thing about it is that it's not that expensive. If you come to Luth, for example, you have hematology, you have pediatric hematologists, you have pediatric oncologists. So it's the awareness, not every doctor is specialized in treating particular illnesses. So if you go to the right place, you get the detection, you get the test you're supposed to have early, and then get a diagnosis early.
And also, just to quickly add some thoughts to that, and that we understand Nigerian health systems, okay, from the primary, secondary, and the tertiary, and that's why the knowledge, that's why this conversation is so important. The knowledge of cancer, even we begin to see how we trickle it down to the primary health care. Yeah. Because, someone can visit the primary health care and a health worker can decide to hold the treatment and say, okay, let's be doing this on this child. And that is what we've seen. And that when you ask people, oh, why do you come? They said, I went to the hospital. And that's why I like the fact that she mentioned that when the child is sick, and ensure that the child should see a pediatrician. But we understand the healthcare system that sometimes it's not always like that. And that's why it's so important to everyone that works in the primary healthcare to have an understanding that not everything you see is a common illness that you can generalize. And especially if this child has been coming to the hospital every now and then, do well to refer.
But let me take you back memory lane, because this issue of childhood cancer is worrisome.
Yeah.
And our forefathers before now, we hardly hear such illnesses. And so tell us the eating habits. What are those things our parents need to know about what to give a child or what they should take
To prevent
to prevent cancer?
Really, it's not been
Just
shown.
prevent the likelihood.
Yeah, so diet hasn't been shown to cause many cancers in pediatrics. Okay, so we talk about colon cancer in adults. They've said red meat and all of that. But in children, we haven't seen anything, linking diet to cancers, because some of our children that have come down with cancers, the mothers stop everything. They stop sugar, they stop Ribena, they stop everything, and these children are, crying. I just want a drink, and we're like, give them once in a while. It hasn't been shown to be linked. What has been shown to be linked to cancers are things like genetics, things like viral illnesses. There's one very annoying virus we call EBV virus. It has been linked to a lot of cancers. But these things are just in our environment. It's nothing you can do to prevent a child from having EBV virus, for instance. So the things, and most of the time, there is no cause. There's no known cause. So that's what I'll say.
It's important as a parent,
Okay.
as a caregiver, to pay attention to your child.
Yes.
You know your child very well. You know this child is active, suddenly becoming active.
Yeah.
You've been taking a bath for your child in the morning, you notice a lump or something is swelling somewhere. You notice a paling of a child somewhere. You know your child.
Yeah.
So pay attention to the health of your child. Take your child to the hospital. And if you're not getting the results that you want as a parent, you have a right to say, can you refer me?
Yes.
And
Okay.
refer a child.
And you are not advocating for self-treatment.
No. Cancer treatment is not something you treat at home.
We have a lot of people who have this spiritual.
It's not even
perception.
something
I
you
actually
treat.
read about something like that.
It's not even something you treat in a medical center
Yes.
or in even some government hospital. It's
Cannot.
not something.
But what
cannot.
would you say about people that believe so much in natural medicine, drinking agbo, juice
those
cleanses, herbs? What would you say to this kind of people who strongly believe in that?
I think from the medical perspective, like she said, all these has not been proved scientifically as a solution to this problem.
And sometimes, it even causes more problems. So this agbo we are giving, what's the dosage? You're giving a little child of 3 months, you're giving them a bottle of agbo. You don't even know what is inside. I'm not saying herbs don't work, but it has not even been, what's the word now?
Scientifically researched.
Yes, researched. Okay, so what is inside this agbo? What's the dosage and all of that? So, and sometimes the children now come down with kidney failure on top of the cancer because they're misusing herbs and all of that. So we don't even advocate that.
So let me come to Dr. Akindele. What's your organization doing at the moment to ensure that we reduce this increasing rate in childhood cancer?
Okay, so for example, this is September, and one of the things we do in September, and that's why we're always good for TVC Communication, for always giving us this privilege every year, February and September, to raise awareness, to talk to people that there is this happen of a childhood cancer. And so we're doing a lot of things, because one of the things we focus on that is lacking is education and awareness. And this education and awareness, like I said, trickles down from the primary health care. And so we try as much as possible to develop the capacity of people that work in this primary health care and let them know these are what you are not treating, you are not diagnosing. What you need to know is you see this, you see this, you see these signs, please refer. And our system is primary, secondary, and tertiary. So what we've done is we pull out the secondary and say, when you see this, move this child to tertiary. We will treat it. And the good thing is, this child might even get to the tertiary center and the problem might not be cancer. But the thing is, the child is in the right hospital that is going to definitely get treatment. And so after that, we're also trying as much as possible so that we can close this gap to develop the capacity of the professional themselves through training programs that they need. I mean, treatment is advancing. I mean, not everybody can just move out of the country to just go and develop themselves. So what we try to do through some of our programs is we bring in these experts outside the country through trainings, virtual trainings, and close the gap within it, and then the trade courses to them. I mean, on radiation oncology, on pediatric oncology, on play therapies, on all these trainings programs that could do. And also, one of the things that we've seen as a gap is everybody tries to work in silos. That, okay, I'm here. So we are trying as much as possible to bring all these professionals together into a working group. For example, there's a working group called retinoblastoma. You mentioned retinoblastoma working group. In this country, we have amazing experts. Amazing.
And they are not leaving the country?
They are not leaving the country. I have a retinoblastoma expert in Ilorin that she is an amazing person. So that's why I tell people, I have seen a child diagnosed of cancer in Nigeria, treated in Nigeria, and survived in Nigeria. Many of them. So we have
early detection. That's what you are.
Early detection, okay. Yeah. So we have those answers. So we are creating those working groups and telling professionals that are having interest in this to join this work. So I am doing something in Lagos. You are doing something in Ibadan. You see, you see what we can compare our works together through multidisciplinary committee. We have joint clinics. For example, when a child goes into clinic now, the child maybe is seeing a pediatric oncologist, maybe is a brain tumor, for example. Pediatric oncologist is sitting, and after, okay, so I'm going to refer you to go and see a neurosurgeon. Mm-hmm. It's okay, they're going to book 2 weeks appointment. Something has happened in that 2 weeks. Mm-hmm. But what we've done now is, you're doing a joint clinic. A neurosurgeon is there, a pediatric oncologist is there, a radiation oncologist. So they are also
with all of these experts you've mentioned.
Yeah.
The cost implication is key.
That one is there.
That is what we need to address. Because a lot of people will say, okay, with all these experts, how much will I pay? How much am I earning?
Sure.
And that's why you see a lot of people will just say, let me leave it in the hands of God.
What options?
Yes.
What options
so
are there for low
anywhere in the
families?
world, cancer treatment is expensive.
Yes.
It's just that some developed countries, we have funding for children, for childhood cancers, and that's what we should be looking into, the government should be looking into. But we thank foundations like Dorcas Foundation. They have funded a lot of our children from beginning to end of treatment. Yes, they've
Without
gone home.
Anybody?
Sorry?
No string attached?
No strings attached. People donate, and donations, everywhere in the world, it happens. They GoFundMe and all of that, because families cannot take on the burden of treatment of cancer. But moving forward, the government too, if we can use it as a means to tell them that, children need funding. Children need a lot of funding for cancers, because when there is treatment and they finish their treatment, the outcomes are beautiful.
Amazing.
In developed countries, as he said, 80 to 90% of children are cured of cancers, and we can do that here. There's nothing fantastic they are doing there. All the treatments they have there, we have them here. Chemotherapy, radiotherapy, surgery, and all of that. We have it here, but the problem is funding. Okay. So some children start treatment, they go to herbs and agbo because it's cheaper. So we need funding, basically. So yes.
Your organization also helps with that.
Yes.
Yes. I mean, that's the core of our work. All programs are just what we do.
Are they free? For example, are they
free? I mean, pick your child from, like she said, from the beginning, we enroll the child. You don't need to know anything.
I love that, because you don't have to know somebody to know somebody.
You don't know. I just work. We just walk into the hospital.
Okay.
Lutz is one of the hospitals we work with. We just walk into the hospital. I mean, there are referral forms. We look at it and say.
So for someone that is watching you at the moment, I want to will say, okay, can I just come to your foundation and
so for someone that is watching me at the moment, ensure the child is in the hospital.
Okay.
Yeah, it's not something is in the right hospital. So just call us, let us know. We direct you. And some people, what we've seen even in this work is some people don't even need the money. They just need the guidance, the right place to go, both locally and internationally. And then we have a patient navigation system that because that's another very, very silent problem. Because somebody just get into the hospital and then where to go is the problem. Or the doctor just give you one big English and say this, and you're like. But there is a patient navigation system that we've put together that holds your hands all through, and then you're fine.
Okay, well, I want us to be a bit practical this morning.
Yeah.
When you have a child, because you said something earlier that when a child is frequently ill, so what are those steps you need to take? Because we shouldn't just make it blanket. So how often do you now need to go and do the tests? And what kind of tests do you have to carry out?
So I'll use the most common, leukemia.
Okay.
So I think we should make second opinions normal in Nigeria, like normalize it. My child is not getting better. I've been seeing this particular doctor. I've been going to this particular hospital. I need a second opinion. If it's a child, I need to see a pediatrician. For leukemia, the first test we do is a blood test, not expensive. I mean, you can even pay maybe 3,000, 3,500. We see some parameters that point that, okay, there's something wrong with the bone marrow. It's just like leukemia is like cancer of the cells, of the white blood cells, you know. So we say, okay, this child is anemic, is pale, or the platelet count, sorry, I'm being a bit technical, the platelet count is low, you know, so that's the first step, but there are different other levels of tests we need to do. That child will also need like a bone marrow aspiration, take, you know, some part of the bone, go and biopsy it. So there are different levels. I can't say everything because there are different tests for different cancers. But the first step is seeing the right healthcare professional. We're not going to come and say you must do all the tests for us to start treatment. Sometimes we do particular tests that are important. We start treatment while you look for money for other things. You understand? So we understand the condition of most parents in Nigeria. So we don't just waste money on tests that are not very important.
What
so
can
that's
the
what
government do to help, should I say, reduce or to tackle childhood cancer in Nigeria?
So government is, I will keep with, because I've been in this journey for like 8 years, so I'll keep referring back to what we seen, 10 years ago before. Yes, the support of government towards cancer generally and childhood cancer has improved, like what we used to before. Before, childhood cancer is not in the National Cancer Control Plan, but now it is there. So that it's a lot of relief that there is an attention to it. Yes, we are not where we used to be. We are still trying to advocate for one or two things, such as insurance, childhood cancer being part of insurance plan. Okay, children that comes up with cancer have access to maybe free admission fees in the hospital and stuff like that. But the government are actually, because the impact we've seen today is as a result of government support. Today we are talking about we building international collaboration with international hospitals. Is because the government support. Today, Nigerian is looking forward to host a global congress on childhood cancer for the first time. It's because government support. And government has a cancer health fund. We have a dedicated organization within the health system that is focused on cancer. They are called Nigeria Institute of Cancer Treatment and Research, NICRAT. So we have those dedicated hands that government has separate, but yes, a lot is on the table. Everyone is trying to push their own to the front and say, children do have cancer, children can survive cancer. So what we are doing here this morning is to put our agenda on the table that childhood cancer needs a lot of focus, the way we focus on breast cancer every October. Because by October, maybe you'll be on pink something now. So by October, this is September. Try and be on gold. That's why I'm so happy with your gold and black stuff this morning. And so please, just do something gold. And when people ask you, why do you work? Say, I'm trying to raise awareness for childhood cancer.
Dr. Korede Akindele and Dr. Oladunni Okuduga. Thank you so much for joining us.
Thank you for having us.
Thank you for having us, and thank you TVC for this.
Thank you.
Well, we'll take a short break now, and the entertainment segment comes up afterwards.